Hello, we all want to improve our consulting skills with patients until we become excellent at these consultations. But part of that is to become aware of factors which might affect how the patients present to us other than the illness itself. One of these factors is the cultural background that the patients come from. Not just that, it's the cultural background of us, which can also influence the consultation with the patient. And that what brought the concept of cultural competence. Now, what does cultural competence mean? I define it as being aware of negotiating the differences in healthcare related perceptions and preferences that result from cultural biases. Now, patients would come with different ideas, they will come with different perception and different health beliefs, and all of these can be influenced by their own cultural background. Our cultural background can affect the way we present our um, management or our decisions and the way we actually explain things to our patients. Now, when we talk about culture, there are different elements of culture. One thing that might come to your mind is how people are dressed, the language people might speak, the food people eat, different literature, and all of these things. But that is just the tip of the iceberg. It does hide underneath a lot of values, beliefs, and sets of norms that patients actually developed and grew into until they become the patients that we see, and they present with the cultural um, um, attitudes and cultural norms that we see in them. Now, there are lots of literature which are written on the culture in the UK. Example is Watching the English, a book written by Kate Fox. Now, when we talk about how the cultural background might influence and affect the consultation with the patient, important thing to think about is how this can actually affect the patient's ideas, concerns, and expectations. For example, patients' ideas might be things like use of injections. They might believe in injections as the only or the proper painkiller. So they might actually think you haven't taken their pain seriously when you offer medications or tablets as tablets. The use of antibiotic for cough. They might believe that cough is treated with antibiotics, and that might actually come from where they came from, the culture that they came from. And there are many other examples as well. Some women might believe that the menstruation should normally become painful, and therefore they may not consult or ask for help. Unfortunately, some patients might believe that GPs generally are less knowledgeable or less experienced than hospital doctors. Again, that might stem out from the cultural background that they grew into. Now, when we talk about the expectations of patients, now the expectations can be varied. They might expect the way you come across to them, the way you communicate with them, can be different from the way you expect how doctors should communicate with patients. And that is very important to become aware of. They might be expecting investigations with every consultation. Some patients might expect the doctor only to give advice if they are able to examine you. So if you don't lay hand, they may not actually trust the diagnosis that you made only from the history. And the extent of their frequency and their health check. Not many patients would believe in the idea of health promotion. and in the other hand, some people would believe that they have to have regular blood tests even if they don't have any medical problem. The involvement of the family in decision making, that can largely be influenced by the cultural background of our patients as well. Now there is a study here that actually looked at the expectations of different population groups and different ethnic groups in in the way they expect how doctors should uh, behave and how doctors should um, provide the care to them. And actually, they found that there is less satisfaction from people from ethnic minority from the healthcare that is delivered to them. And the part of the explanation for that could be because there is always the assumption that people um, would be unicultural to the British culture that they are practicing the medicine in, which is obviously not the case. Now, how do you master your cultural competence? How do you become good at it? And I will divide that into two parts. We'll give you about 4 principles of things to bear in mind, and then we'll talk about 6 tips, steps to take to appear during a consultation and to show during the consultation how culturally competent you are. Now, the first principle is it's always important to know the distinction between the principles and the values. The difference is that principles are universal. For example, honesty is appreciated, is valued, and it's a principle that can happen across different cultures. Being respectful to others, that again is something that is universal across cultures. So principles are the things that we do adapt in dealing with every single patient, regardless of what culture they came from. But the values these are set of norms that can be influenced by the culture of the patient. For example, how paramount the concept of the family is, that can be different from culture to culture. In individualistic cultures, for example, it may not be very important for the patient to involve the rest of the family in decision making, but in the collectivistic culture, for example, that is very, very important, and the patient might want the involvement of other family members before they can reach a decision. The second principle is to remain genuinely curious about the cultures of different patients. You would be surprised to know how pleased patients would be when you show curiosity, asking them, okay, tell me more about, for example, what do you do what do you normally, how do you normally do these things? Tell me more about, for example, the where you grew up as a child. I haven't been there. So there are lots of things that can build the rapport between you and the patient by becoming curious, genuinely curious about their culture. And the third principle is always to reflect on cultural incidences. Many of us might actually come across situations where you come across an embarrassing incident, or you might come in an awkward situation because you haven't taken the cultural dimension of the consultation seriously, and that can actually become a problem. The important thing is to actually reflect on these. The more we reflect on these incidences, the better we learn from them. And we always have to accept there will be some difficulties, and even though after you put all the effort into the consultation, sometimes unfortunately there will be some difficulties during the consultation. So accepting these difficulties, not taking things personally, is also an important concept. Now, what are the tips to show the cultural competence during the consultation? So this is where we want to put things in practice. Now, the first advice is to listen curiously. Always listen to the patient, and they will tell you what they believe in. They will give you the hints, they will give you the clues. Make sure that you listen to them. And the second tip is ask. Do not assume. Just because the patient who, like a gentleman in his 20s, walked in with a accompanied by a woman in her 40s, do not assume that this woman should be his mother. Again, that assumption might come from your own cultural beliefs of what kind of age difference between couple might be. This might be coupled rather than, for example, a parent and a child. And a third tip is do not freak out even if you are freaked out, because sometimes, as I said earlier, our own cultural background will affect the way we perceive things that patient present with. And if you feel you feel surprised, if you feel freaked out, it's very, very important to actually accept that, to try to stay non-judgmental. Otherwise, it might offend the patient. The fourth tip is beware of the cultural overlay of language and the linguistic overlay on culture. What does that mean is the language itself, the way people say things, is influenced by their culture. For example, in the British culture, courtesy is something very important, something very essential, and as a result, they might, if they want to ask for something, they might ask in a way, in a question. For example, do you want to do that for me? Although what they want is not actually the answer to the question. What they actually want you to do that, but they don't put it as an order or as a request, but they put it as a question of do you want to or would you like to. The fifth tip is always make sure that things are not getting lost in translation. So make sure that you've got an appropriate professional interpreter when there is a language barrier. And the last tip is try to locate the patient in the process of adapting to the local culture. Now, when we talk about people having different cultural backgrounds, it might be people who are born and raised in the UK, but their cultural background is different. But it might also be people who have actually migrated to the UK, and these people can be of at least two different kinds. So there are people who would prepare to come to the UK, might study to come to the UK, come and work. So they have spent years preparing for something like this. They might have actually learned about the UK before arriving here. Their arrival might be gradual. So these their experience can be different from someone who is a refugee, who unfortunately happened to be a refugee and then landed in the UK, and they don't have the luxury of being prepared actually to adapt to the culture of the UK. So we have to actually be mindful of that. So trying to locate where the patient is, how long has the patient lived in the UK, does actually matter as well. Do they actually work in the UK or they study? All of these can actually influence the way they adapt into the UK culture. And remember, you don't have to become completely impartial. We know we are not robots, we are human ourselves. So there is no problem sticking to our own values. The point of this presentation is to become aware of our own biases, of our own perception that can be influenced by our own cultures, as well as the patient's perceptions and health beliefs, which can be influenced by their own cultural background. Thank you.